Hello and welcome to 12 to Your Health. I'm your host, Dr. Derek De Silva. Getting the family together for the holidays can be a lot of fun, but not always for people having trouble conceiving a child. From the non-stop questioning about when you're going to have a baby to seeing everyone else's kids at play, it can be an especially stressful time. Here to help you get through it and talk about infertility is Dr. David Corley, an OBGYN and fertility specialist with the Sher Institute of Reproductive Medicine right here in New Jersey. Thank you so much for joining us.
Thank you for inviting me.
It's got to be a stressful time. People, at parties during the holidays asking about, hey, when are you going to have a baby? We hear that all the time, don't we?
Absolutely. And any event that brings people together, especially family events, will always put stress on couples that have been trying for months or maybe years to have a child. And so that situation does become very stressful for them.
Why do we have such a problem with infertility in the country right now?
Infertility is actually a twofold situation. You have the young group of individuals that are having fertility problems, mainly women that may not ovulate regularly or men with poor sperm counts. Then you have the second group of the older women or older couples that have wanted to establish a career, and now they're going back to try to get pregnant, and those tend to have problems.
Solutions? So what are we've all heard about in vitro and some of the other chemicals and hormones and things that are out there. What are some of the more up-to-date things that people can do as far as infertility goes? Couples can do, excuse me.
Sure. First of all, the basic thing is just to get a basic understanding of what could be giving the infertility couple a problem. Some basic hormone test on the female can tell us how well her ovaries are functioning. A semen analysis can tell us how well the man is functioning as far as his sperm count. And an x-ray to make sure that at least that the patient's fallopian tubes are open. If these three categories are looked at, most fertility problems can be addressed with one or several of those situations.
I think also metabolically, when we look at a person's metabolic state, whether it be thyroid, blood pressure, issues like that, one thing that I see in my own practice as a primary care physician are couples that have problems with infertility. The women are in that borderline thyroid situation. Can you just comment on that and what your feelings are on that?
Correct. Women in general tend to have a higher incidence of thyroid problems, possibly due to the establishment of antithyroid antibodies that develop throughout their life. These can either be stimulating antibodies or suppressing antibodies, so the patients may present with either hypothyroid or hyperthyroid. The thyroid functions are basically, our thyroid hormones are produced in the pituitary. Also are the fertility hormones produced in into pituitary.
Right.
So when you have a situation with one type of hormone problem, it can impact the other. So then women that do have problems with thyroid may also have problems with stimulating their ovaries for the production of eggs, as well as the men stimulating their testes for the production of sperm.
Now, at what point does someone say, does a couple, I keep saying someone, but a couple say that, we've got a problem here. Is it 6 months? Is it a year? What's the cutoff? What's your average here?
Okay, that's a very interesting question. If you follow the books will say a couple should try to conceive over a year, and that's basically trying to conceive every month for a year. Now, unfortunately, not everyone falls in that category, and my preference is anytime a couple feels like something is going wrong, whether it's 2 months, 3 months, they should at least have the basic evaluation, which I alluded to at the beginning.
What is the basic evaluation?
Hormone test on the woman, usually done on what we call cycle day number 3 or the 3rd day of her period. It looks at her FSH, which is follicle stimulating hormone, which controls the ovaries. The semen analysis, which is the basic test just to check the male for fertility potential, as well as an HSG or hysterosalpingogram, which is an x-ray to confirm that the woman's tubes are open. Because those three factors, the eggs, the sperm, and whether or not they can meet through the fallopian tubes are the priority reasons why most couples cannot conceive.
So you're going to Uncle Joe's house. You've been trying to get pregnant. The pregnancy hasn't happened yet. What do you say to Uncle Joe and Aunt Helen when you're there for the holidays? What's the best way for couples to approach that when somebody asks them that question?
For younger patients, I basically say, yes, you should check with your family physician or either with your obstetrician, OBGYN, because usually they can do those basic tests. However, if a couple's approaching 32, 35, they really should seek help from a more experienced fertility physician, such as a reproductive endocrinologist, in order to get those tests and then move ahead with some form of treatment.
Yeah, and then the other thing is, when should couples start preparing for pregnancy? How far out?
Preparing for pregnancy.
You know, I mean, what do you need to do? You need to start taking your multi, you need to change your diet, preparation for pregnancy.
Absolutely. I always recommend, at least if they want to plan a pregnancy, which most pregnancies are not planned.
Right.
But of those who do want to plan a pregnancy, definitely start prenatal vitamins at least 3 months before you're ready to get started, as well as working at a good balanced diet, exercise. All of those helps the situation.
We thank you very much for joining us. It's a pleasure to have you here. Thank you for that great information.
Pleasure to meet you.
Stay with us right here.